السلام عليكم، يعطيكم العافية جميعا. أتمنى يكون الصوت واضح والجميع يقدر يسمعني. نشكر الجميع على الانضمام، نشكر المتحدث الدكتور أحمد. نتمنى لكم ندوة مفيدة تعود بالفائدة للجميع إن شاء الله. لو سمحتوا الجميع يعني don't raise hand، لا تحاولون أنكم تضغطون، لأن المشاركة فقط بالاستماع للحضور. الQ&A مخصص للأسئلة متعلقة بالمحتوى لكي تعود الفائدة للجميع إن شاء الله. الحضور الجميع مسجل، مجرد حضورك ودخولك في الندوة أرجو عدم السؤال عن الحضور وتأكيد الحضور، لأن الجميع مسجل في النظام بمجرد دخولك وحضورك. نشكر الجميع تعاونهم، وللفائدة للجميع أرجو الجميع يلتزم بجزئية الQ&A أنها تكون متعلقة في المحتوى فقط. بالتوفيق للجميع. تفضل دكتور أحمد.
طيب، بسم الله الرحمن الرحيم. Good evening, everybody. First, I'm going to introduce myself. I'm Dr. Ahmed Al-Malak, Senior Registrar Endodontist, certified from the Saudi Board of Endodontic 2017, and also certified from the GCI MOH Infection Control Diploma 2013. First, I want to thank the Saudi Society of Restorative Dentistry and the Saudi Commission for Health Specialty for giving me the chance to share the knowledge with you regarding the pandemic of COVID-19 and its relation to dentistry. In the beginning, I want to give you two questions just as a survey for your knowledge about the important points related to the topic. So please answer those two questions. I will give you about 2 minutes, then we will start the presentation. I think there is an option called polls. You will find the question. Please answer the two questions. Only one answer is allowed. And at the end of the lecture, I will see how many get the right answers. Answer please in the polls, not you will have multiple choice. Just click on the right answer. I just put this question on the PowerPoint presentation, but you will find polls option and you can answer the question, please. Okay. First, I'm going to talk about the definition of coronaviruses, which are a family of viruses, RNA family, that cause illness ranging from common cold to more severe diseases. Started at 2002 in China. The emergence of SARS-CoV, which is called SARS-CoV-1, and then the 2012 the MERS-CoV, or Middle East Respiratory Syndrome, which is first reported in Saudi Arabia, and 2019 the COVID-19, which arise also from China, Wuhan city. I think everybody now knows the Wuhan city because of it's the origin of this pandemic that we live in today. They are called corona from the word crown, the Latin word crown, which resemble crown in shape. It is named SARS-CoV-2 by the International Committee on Taxonomy of Viruses. Then the WHO called it the COVID-19. The word COVID-19, the CO from the coronavirus, and VI for virus, and the disease 19, which is the year of emergence. I don't know if you know this animal. In China, they have a lot of food markets, which they eat many variety of animals and weird foods. This called pangolins, which they suggest that it is the intermediate host that transmit the virus to humans. But this is they think this is the origin of the corona family, the whole corona family, which is bat. For the SARS 2002, they think that bats transmit the virus to cats or other animals, then transmit it to the humans. They think that the virus is mutated and transmitted to humans. For the MERS-CoV, the Middle East Respiratory Syndrome, they also think that the origin is from bats, then the virus is mutated and transferred to intermediate host, which is camels. And for the COVID-19, also they think that the origin is bat and mutated, and the intermediate host is pangolins, then the virus mutated and transmitted to humans. First, I'm going to talk about the chain of infection, which is the infection results from an interaction between an infectious agent and susceptible host. This interaction can occur by means of contact between the agent and the host, and is affected by the environment. Breaking the chain of infection by interrupting transmission is generally the best way to prevent their transmission. So what is the chain of infection? The infectious agent and the reservoir, infectious agent like viruses and bacteria, and the reservoir, the place where the microorganism lives in, port of exit, how it exits from this reservoir, mode of transmission, how it transmitted, and the port of entry, how it enters into the host, then the susceptible host. Okay, so the infectious agent is like viruses and bacteria. Reservoir, the common reservoirs in healthcare facilities, which is contaminated instruments, or the person with infectious disease who's carrying an infectious disease. Port of exit, there are many port of exits, like the gastrointestinal tracts, respiratory tracts, genitourinary tracts, wounds. So the microorganism can exit from the reservoir if it's human. The mode of transmission, which is very important to know. 5 major routes of transmission: contact, either direct or indirect. Direct is from person to person, and indirect through an object, which is very important route of transmission. Now, the MOH recommend in this pandemic for the COVID-19 to wash hands regularly, because of you might get in contact or touch a contaminated surface. Indirect means like when you are going to the ATM and you want to touch the buttons there, and you might catch the infection. This is called indirect contact. Direct contact, when the recommendation from the MOH to not please shake hands, do not kiss, do not come in close contact for any person now, to not get the direct contact transmission. Okay. The droplet like the COVID-19 and the flu, droplets is a heavy molecule, which is more than 10 micron, that when the person is coughing or sneezing, it's very heavy. It will not spread for a long distance. They measure it, it's about 6 feet or 1.5 meters. After that, it will fall down. It will not reach the host. Airborne, for any molecules that is less than 5 micron, which can be suspended in the air and spread for a longer distance. Okay, and there's like that TB is a common example. Common vehicle is through the contaminated instruments or devices. Vector-borne, which is like insects, which might transmit viruses or an infectious disease to humans. Portal of entry, the same way it's exit from the reservoir, it enters into the host through wounds, respiratory tracts, gastrointestinal tracts, and so on. The susceptible host, which is humans. Okay. Standard precautions we have for dentists. We are, I think most of my audience now are dentists and dental assistants or people who work in dentistry. The standard precautions, this is what we apply mainly apply in our clinic. What are the standard precautions? They are a set of infection control practices used to prevent transmission of disease that can be acquired by contact with blood, body fluids, non-intact skin, and mucous membrane. These measures are to be used when providing care to all individuals, whether or not they appear infectious or symptomatic. So we have to deal with each patient like he is a susceptible source of infection. This is the rule number one in infection control. Okay, you have to deal with any patient like a susceptible source of infection. Don't say this is my brother, my son, my relative. Some people, they don't know even about themselves. They may get screening and by accident they find themselves positive to any kind of disease. So it's very important to apply this rule. I'm going to talk about, because I have limited time, I'm going to focus now on the main three points which are related more to our topic, which are hand hygiene, personal protective equipment, respiratory hygiene. For respiratory hygiene, I'm going to start about respiratory hygiene. I think most of people now know what is respiratory hygiene. Respiratory hygiene means that when you cough or sneeze, you have to use tissue to not spread your droplets all around in the environment. You have to use tissue and cover your mouth and nose during coughing or sneezing. If you don't have tissue, you can use your elbow to control the spread of droplets. Okay, and if you feel sick and you have symptoms, you do hand hygiene and put mask, then seek for medical care. Now I'm going to talk about hand hygiene, which is the most important thing in preventing the spread of any kind of disease. The MOH since long years try to make educational programs, do many things, because why? Because it's the main preventive way for transmission of infection in the community and also in the healthcare facilities. So hands are the most common route of transmission of infection. Hand hygiene prevent healthcare associated infection. Hand hygiene is the single most effective measure to reduce the infections. Now I think in the COVID-19 pandemic, I think everyone now knows. I think everybody learned a lesson. Like a community or a healthcare worker, people, if they are not applying the hand hygiene in their practice or in their social life, I think everybody now knows the technique for hand washing and hand rubbing. So it's very important since a long time. But now people can see how important is doing hand hygiene. There are many terminology used for hand hygiene. Hand washing, antiseptic hand wash, alcohol-based hand rub, and surgical hand hygiene. I'm going to focus on the hand washing, antiseptic hand washing, antiseptic hand wash, alcohol-based hand rub. The surgical hand hygiene is mainly is for operation rooms for surgeons to use more strict technique. So hand washing, it means washing hands with plain soap and water. Antiseptic hand wash using antiseptic soap, which contains substances like chlorhexidine, and wash after that with water. Alcohol-based hand rub is using alcohol as an antiseptic agent. Hand washing with soap and water. You have to differentiate between regular soap and antiseptic soap. The regular soap that we use it at home. You can use it before eating, after touching any contaminated surface, or when hands are soiled. For dental, we use it for examination in diagnosis clinic. If we will not do any surgical intervention, we can use plain soap. For antiseptic hand washing using antimicrobial soap, they call it also surgical hand scrub. You can use antimicrobial soap and water for 40 to 60 seconds. The time, you have to take your time in doing the hand hygiene. Indications for surgical procedure or sterile procedures. Okay, hand rubbing with alcohol, or we call alcohol-based hand rub by using alcohol. The time is about 20 to 30 seconds. It's used when the hands are not visibly soiled. If your hands are soiled, you see any kind of soils, dust or whatever, you have to do hand washing with water and soap, whatever is antiseptic or the plain soap. Okay. It's very practical. We all have the hand rub in our cars everywhere. It's very easy and easily accessible, but it couldn't be used when hands are soiled. Also, there is some recommendation to, when you're going out from bathroom, use the hand washing. Don't use the hand rub. They use the hand washing for the Clostridium difficile because it's maybe the alcohol cannot kill it. So you can do hand washing, but it's commonly used. The hand rub now you can see all people are using now. It has a broad spectrum effect, but it have to be used with care. Don't keep it near to the fire or keep it in high temperature. For hand washing with soap, for the skin, the hand washing with water and soap, it may cause more dryness. For hand rubbing, no, it is better. Why? Alcohol naturally has a dehydration effect, but the companies now put emollients or moisturizers, which may make the skin moist and prevent its dryness. Okay. I think everybody now knows the technique for hand rubbing and hand washing. Studies show that, you can see this photo, commonly missed area, this most frequently missed area in this red areas, fingernails, and this thumb areas mainly missed during doing improper hand hygiene technique. So we have to stick to that good technique to protect ourselves. Okay, now I'm going to talk about the personal protective equipment. From dental point of view, the use of rotary dental instruments, example, handpieces, ultrasonic scalers, air water syringes, creates visible spray of droplets of water that contains saliva, blood, microorganisms, and debris. This spatter travels only short distance, landing on the floor surfaces or in the dental healthcare provider, cloth or whatever, or patient. The spray may contain aerosols, particles. Aerosols means particles less than 5 micron. Spatters or droplets, which are heavier, they are more than 5 microns. Spatters or droplets, they are heavier molecules or liquids. There's something called splash. The splash is a big volume of liquid, like when you have a cup of water and through this water, this is a large volume of liquid. It's called splash. So please focus on the words aerosols, droplets, or spatters, and splashes, because it will be related to the next slides. Aerosols can remain airborne for extended periods and can be inhaled. So we need barrier to protect us from contamination. Okay. Definition of personal protective equipment: specialized clothing or equipment worn by an employee for protection against infectious materials. Protective clothing, protect skin and clothing. Gloves, protect hands. Face protection. Mask in combination with eye devices such as goggles or face shield, head cover or cap, and footwear. This is surgical mask, goggles, face shield, gloves. Who can tell me the difference between this and that? So they are not the same. You have to differentiate between what called mask or surgical mask or respirator. This is called respirator, which is N95 mask. This is used for airborne infections. And this is in Europe, they have a different type of mask called FFP1 and P2 and P3. It's, with higher filtration rate. It could be used like starting from the FFP2 to give you filtration about 98%. The N95 is called N95 because it's give you a filtration rate of about 95%. Gowns, head cover, foot cover. As a dentist or healthcare provider, we have to do the selection of PPE will depend on the risk of contamination of staff clothing or skin by patient blood, body fluids, secretions, and excretion, and the risk of transmission of microorganisms from the staff to the patient. So, factors that influence the selection of PPE. What procedure that you will do? If you are in diagnosis clinic, you will wear full PPE? No, there is no need. You will just consume the PPE without need. So if you are in the diagnosis, no chance for any aerosols or spatters or anything. You will be protected by only mask and gloves. But if there is any use for hand pieces or ultrasonic or anything will make aerosols or spills, you have to wear your gown, mask, eye protection, and gloves. Okay. So you do risk assessment before you start your procedure. Anybody knows the transmission-based precautions? For the transmission-based precautions, it's mainly used in hospitals. But I think in dentistry now we will focus on the transmission-based precautions. We are concerned in dentistry about the blood-borne pathogens like the hepatitis, HIV. So we stick to the more to the standard precautions. The transmission-based precaution are expansion of that standard precaution. A set of practices that apply to patients with documented or suspected infection or colonization with highly transmissible or epidemiologically important pathogens for which precaution beyond the standard precautions are needed to interrupt transmission in healthcare setting. What does that mean? You can see here this table. This is the standard precaution we mentioned before. For airborne precaution like tuberculosis, chickenpox, measles, you have to wear the N95 mask. When entering room, must have a private room with monitored air pressure, negative pressure, okay? So for airborne precautions, if you are going to deal with a pure airborne infection, you will wear the N95 mask. Some routes of transmission are like flu, like COVID-19, for example, it's droplet and contact, 2 routes of transmission. So you will have to take both precautions. For dentists, you have to know this transmission-based precautions, because I think the future we will change some of the protocols for protection of the patients and the healthcare workers and the environment. For the droplet, we regular surgical mask. If within 3 feet, if you are in close to contact to the patient, or make the patient wear mask during transportation. These precautions, I will talk in detail later. We have to maybe change our view regarding infection control now as a dentistry. For droplet precaution, what are the common examples, like influenza, pneumonia, also the COVID, the MERS-CoV. For contact, when you enter a contact, enter in any room, isolation room with contact precautions, you will need to wear only gown and mask, gown and gloves, no need for mask. So to not just consume the PPE without need. So in the MOH, we have color-coded or color code for each type of precaution. Like airborne is blue, droplets red, contact is green. It's differ from country to another, but the color coding is very helpful. And just viewing the color, you can know what kind of infection is there. See, this is from the CDC. They put in different color coding and what precautions you have to do. Like here, you can see for the airborne, 95 respirator. Anyone entering this room must wear the N95 respirator. Also ensure that the door to the patient room remains closed and that the pressure is negative and monitored. The air exchange is minimum 12. So we have to know all this type of precautions. Okay, are transmission-based precautions applicable in dentistry? I will let you answer this question after talking about details in dentistry now. What could make the dentist stressed during this pandemic spread of COVID-19? One, fear from treating a patient who might have COVID-19. Two, fear from not having enough protection. Okay, COVID-19 mode of transmission. According to the WHO, CDC, and Saudi MOH, it's droplet and contact transmission. Okay, it's very clear. It's droplet and contact, not airborne. Okay, airborne precaution for aerosol generating procedures for suspected COVID-19. This is what is applied in hospitals. What kind of preventive measures that have to be done in AGB. AGB is aerosol-generating procedures. Any procedure that create aerosols in the environment. Let's see what they mention. Nasopharyngeal swabbing, tracheal intubation, non-invasive ventilation, tracheotomy, cardiopulmonary resuscitation, manual ventilation before intubation, and bronchoscopy. This is from CDC, but nothing mentioned about the dental procedures. Okay, so this is for hospital setting, but nothing mentioned about using high-speed handpiece or ultrasonic or anything that cause aerosolization during dental procedure. But what I find here is the definition of what is an aerosol by the CDC. This photo is from the CDC. The same. Everything is I take it from the CDC definition. Okay, and the National Institute for Occupational Safety and Health. They put this photo. Let's see what they say. Simply define tiny particles or droplets suspended in the air. The haze in the picture on the right is caused by light scattering from numerous water, oil, droplets, and mineral particles released into the air from the drilling of a rock. This is from CDC. How about drilling inside the tooth? How about drilling inside the mouth, saliva, blood? So I don't know why they did not involve the dental procedures as an aerosol generating procedures. Why using handpiece, ultrasonic, and suctions in dental are not considered an aerosol generating procedure? You can see this high-speed handpiece. See how many aerosols are there. If you try in your clinic and you push the foot control and see the water, put the light of the unit toward the ceiling and press the handpiece, you will see how many aerosols are spreading and how far they can go. Imagine this aerosol is reflected from the patient mouth with saliva and blood. What does CDC recommend in case of treating suspected COVID-19 case in hospital setting with aerosol generating procedure? Use a fit-tested particulate respirator, N95. Healthcare workers that all available type of N95 are not fit to him should be avoided from aerosol generating procedure, or use powered air purifying respirator. Yani, the beard people, mainly the males, they have beards, even if a little hair on the face, they will not fit to N95. They have to use the buffer. I will show you the photo of the buffer to protect themselves. Facial hair, beard prevents proper respirator fit. Either avoid aerosol generating procedure or use buffer. Okay. Use eye protection, goggles or face shield. Clean, non-sterile, long-sleeved gown and gloves are used. If gowns are not fluid resistant, use a waterproof apron for procedures with expected high fluid volume that might penetrate the gown. Perform procedures in negative pressure rooms, okay, with at least 12 air change per hour, and control direction of airflow when using mechanical ventilation. See how strict this is. Airborne precautions, okay. This is for hospital setting, nothing mentioned about dental. Limit the number of persons present in the room to the absolute minimum required for patients' care and support. Recently, the American Dental Association, American Association of Endodontic, they started to make as an American Dental Association, it's considered as the guideline for almost all the dentists around the world. They during this pandemic, they recommend that delay any emergency treatment and only delay any elective treatment and just only treat the emergency treatment. And they list some of the emergency situations that you have to interfere. You can find the ADA interim guidance for management of emergency and urgent dental care, because the COVID-19 make many changes. So they made an urgent and interim guidance for management of emergency and urgent dental care. This is an interesting study by Hargreaves. It's just published, recently published. It's a very nice study. It's called Coronavirus Disease, COVID-19 or COVID-19 implications for clinical dental care. I highly recommend to read this article. But I will talk about the important point in this article. As you can see here, it's known that SARS-CoV-2 can bind to human angiotensin converting enzyme 2 receptors, which are highly concentrated in salivary glands. It's very important. This may be a possible explanation for the presence of SARS-CoV-2 in secretory saliva. Therefore, there is a potential for transmission of COVID-19 via aerosols, vomit, or fecal oral routes that may contribute to nosocomial spread in the dental office setting. It's a very important point about this is a risk factor for dentists now. We are dealing with saliva all the time. At the end of this article, they mentioned something. Negative pressure treatment rooms, airborne infection, isolation rooms. Is worth noting that patients with suspected or confirmed COVID-19 infection shouldn't be treated in routine dental practice setting. Instead, this subset of patients should only be treated in negative pressure rooms. Therefore, anticipatory knowledge of healthcare centers with provision of negative pressure rooms would help dentists to provide emerging dental care if the need arises. I'm going to criticize this because they did not provide also details. How can I will do dental treatment in isolation room or negative pressure room? They recommend, but they don't talk in details. Now we are in a crisis, so we have to know details about anything, everything, and to stick to guidelines or something. But maybe the pathway that they did in this article is very good. But for details about how I'm going to treat those patients, nothing mentioned details. This is the list of emergencies they mentioned in the article, like avulsion, luxation, trauma, acute apical abscess. What kind of management? You can find it in the article. They made this pathway. It's very nice, but in the end, perform if the patient is suspected and emergency treatment, and you have to interfere. Perform dental treatment in negative pressure room or isolation room with HEPA filter. They mentioned that, but how? Nothing mentioned. So, do you think dentistry will be changed after COVID-19? Suggestion to protect healthcare workers or dental healthcare workers, patients, and the environment. First is to create an ideal pathway for dental patients. We have to do visual triage from the beginning, during this pandemic, and after to continue. You have to triage what kind of patients, if they are suspected, maybe MERS-CoV, Corona, COVID-19, the flu. To triage, if non-urgent, can delay until they get better, then we can receive treatment. This is after the pandemic, inshallah. During this pandemic, you have to triage your patients by using telephone or by when they came for emergency treatment. They have to triage using the form provided by the CDC and the MOH. You can modify it for dental to just know that the patient is not suspected to enter your dental department and spread the infection there. So triaging is very important for emergency cases. Okay, if the patient is suspected of COVID-19 or any other respiratory disease, according to the triage form, and needs urgent intervention, my suggestion are to take airborne precaution as dental procedure, especially when you will use high-speed handpiece, will cause aerosolization, or you will use ultrasonic. You have to take the airborne precautions. This is the form for triaging applied by the MOH. It is updated every day, every week. It's according to the situation of the pandemic, but you can use it to triage your emergency case. The people now, they come for emergency, only for emergency. So you can triage, you can use it to see the scoring. If it's 4 and above, you have a suspected case, you have to give him mask and let him do hand hygiene and take mask and seek and refer him to the hospital. Okay. Also suggestion based on how medical staff deal with airborne infection, which means it has to be done in airborne infection isolation rooms, single room with HEPA filter, taking both droplet and contact precautions during dental treatment. So you will be airborne droplet contact. So we'll use N95 respirators, and the room have to be with negative pressure and air ventilation for treating emergency case with suspected COVID-19 or MERS-CoV cases. So we'll use N95, as I mentioned before, how they, or the bubble, how they will manage in the hospitals. This is the bubble, powered air purifying respirator, used for bearded people, or if some person or healthcare workers did not have a fit N95, he can use this bubble. And this is the N95 respirator. This is an example of negative pressure room. You can see this is anti-room, and there is a negative pressure, and also you have HEPA filter in the duct to provide a 99% filtration rate. So this is a good environment for any airborne precaution. This is an example of a HEPA filter. Okay, my suggestion is to construct, and this is a suggestion, to construct one clinic in each dental facility that has a dental unit with negative pressure room, and the dental team take an airborne droplet precautions. Okay, it could be at least one clinic for emergency cases for suspected people for respiratory diseases or COVID-19, or dental clinic with portable HEPA filter, and the dental team would take airborne and droplet also contact precautions. You can have portable HEPA filter and take both respirator, a full PPE as an airborne and droplet precaution. If you are going to use the handpiece or ultrasonic, as it is as it's recommended by the ADA and the AEE, and it's the aerosol generating procedure. Future products. I found many products now, like they have high volume suction. You can see this is placed near to the face of the patient and the dentist, and it has a HEPA filter also, ultraviolet light for sterilization of the droplets or for the aerosols. There is, you can see, there is another product, but actually I think they need more studies and would read more studies. I did not find more studies about, but the concept is good to have a HEPA filter which will provide 99% filtration of the air and mainly used in the negative pressure rooms, and also the ultraviolet light, which will somehow provide some disinfection or sterilization of the aerosols. But as I said, it needs more studies. This is a video for many companies now start to do. Maybe this will be in the future, will be a standard of care. We don't know, but it's the idea is the suction high volume, because the suction low volume, high volume will not catch all the aerosols. When you wear your face shield or face mask as a dentist or dental assistant, you'll find how many aerosols or splashes in your goggles or your face shield. So this might control this spread. So I'll leave you with this video.
The extraoral dental suction system, droplets and aerosols terminator. Do you realize how serious the threat is around you? High volumes of droplets and aerosols are produced by high-speed handpieces and ultrasonic scalers. High and low volume suctions cannot completely remove all the aerosols. Droplets and aerosols splash and attach to the dentist's faces, hair, and clothes. Blood splashback is produced during treatment. Aerosols contain bacterial and viral particles, unable to be seen by the naked eyes. Aerosols become attached to the dentist's bodies during treatment. Coronavirus, flu virus, and other viruses can be spread by droplets and aerosols. Don't worry, we have the extraoral dental suction system. Droplets Airborne. Use the extraoral suction system to terminate droplets. This will help reduce bacterial and viral infections. Blood splashing. Remove blood sprays to defend against cross-infection. Threat of bacterial and viral infections. Use it to eliminate airborne bacteria and viruses. This will help defend dentists and assistants from bacterial and viral infections. The extraoral dental suction system has ultra-strong suction power to capture various harmful particulates effectively. Its 3-layer filtration system with HEPA filtration technology is proven to effectively filter ultrafine particles all the way down to 0.3 microns diameter. The filtration efficiency is up to 99.995%. The built-in medical ultraviolet light will kill bacteria and viruses effectively well. The extraoral suction system operates with minimal noise. The flexibility design of the tubing arms can be positioned to any angle you need. The compact space-saving design won't interfere with the operation of dentists and assistants. The extraoral dental suction system, droplets and aerosols terminator. Help dentists remove potential infections during daily treatments.
Okay. So this is a scenario. During this pandemic of COVID-19, you received a patient with a severe pain that is not relieved by analgesics. The patient said that he has fever and shortness of breath, and he came from a high-risk area that is infected by COVID-19 since 5 days. What is your management? I know the scenarios almost all the dentists' minds, or they think about this. Okay, so this is an severe pain. This is considered an emergency case. Okay, if you are going to deal with this case, this is a suspected case. You have to be done in an isolation room. This is according to what the ADA say now, the American Association of Endodontic. You have to take care. At least you have HEPA filter, airborne precaution, droplet precaution to protect yourself and protect the environment and other patients. Do not be a source of infection. You have to take care because you will use handpiece, ultrasonic suctions. This is very important, and you have to take care if you're dealing with suspected case like that. It's considered scoring according to the triage. If he came and he is not an emergency case, and with symptoms, you have to delay. So after you have to go to the hospital or delay the appointment. No need for intervention now. If emergency and can be relieved with analgesics and antibiotics or whatever without any intervention, delay until you go to the hospital and come back later. If he has emergency and he is high risk according to the triage scoring, so you starting with the triage is very important. We have to do triaging now. So if he has emergency and we need to do intervention with suspected case, you have to take precaution. But first, you have to fill the form, and this is a suspected case. You have to refer to the hospital. Then you can, after they do the investigation for him, you can do intervention in isolation room. We need to do more guidelines. I think more studies are coming, more guidelines coming from the ADA, from all the associations now, because it's a fast spread virus. They don't have enough time to do a proper guideline. I don't know but I think we are going to have many change in the future regarding the infection control in dentistry. I hope this pandemic is disappear as soon as possible, and God bless you. Now I will see some of your questions. Okay, Now I see the survey answers for the questions that I put at the beginning. How does COVID-19 transmit to the humans? 67% answered the correct answer, which is droplet and contact. And there is some people put only droplet and some people put contact. 18% put droplet and 9% contact is droplet and contact. So I think most of you knows the route of transmission. 6% put airborne. It's not airborne. No evidence for it's airborne. If you are talking about the recent recommendation from the CDC or the WHO, that they said that in the United States that they have to cover their face with cloth or cloth mask or homemade mask. This is not because it's airborne. This will not provide protection. They give them that some kind of protection if in situation that they cannot keep social distancing, which is about 1.5 meters, like in any traffic area, any groceries, you have to, they trying to make anything to let them somehow protect themselves. The over consumption of the mask, gloves, it's not necessary use for this PPE. Someday you will make the doctors cannot find the mask or gloves. No need. Gloves in the community will catch the infection. If you are in the community, you are in the supermarket, everywhere, you have to do hand hygiene. Don't wear mask. It will give you a false feeling about protection. So please don't wear mask outside. It's only for what it is intended for the healthcare workers. Also the masks. You don't wear mask in the community unless you have symptoms, respiratory symptoms. Otherwise, no need. Okay, the second question, what kind of PPE you have to wear if you are going to do any procedure using the handpiece? 89% answered the correct answer, which is gown, mask, goggles, and gloves. As I said, you have to do the risk assessment to decide what kind of PPE you are going to do. And the scenario I put in the end about if you are going to, for some reason, a suspected case, after you refer to the hospital and isolated, and he has extraoral swelling, severe pain, and you have to intervene, you have to take airborne precautions because you will generate aerosols. And I think there will be more guidelines from the ADA in the next few weeks. And many things will be changed. Maybe we'll find more devices, more machines, more modifications in the near future. Okay, regarding the questions, one of our colleagues asked how we can deal with dental instruments in this pandemic of COVID-19. You will deal with it. It's nothing the same. What you will do before, you will do it now. Nothing will be changed. You will, if the procedure will be more than 2 hours, you have to spray with the transport gel. Okay, then you will put in covered box or special container with biohazard and use a trolley or whatever for transportation to the CSSD. They will put it in the wash or disinfector and will sterilize it. Nothing will be new. What is the main symptom of COVID-19? Regarding the symptoms, when I see many videos, people they put the air, they measure the thermometer, the remote thermometer, they measure the temperature. If the patient doesn't have fever, this is not confirmed that he is COVID-19 free. He may be asymptomatic. Now the CDC said that, like when they said also you put cloth mask or homemade mask Also, because some people are asymptomatic and transmitting the infection, or pre-symptomatic. So you have to stick to the forms of the MOH or the CDC. You can see this risk factors. He came from an high-risk area. Like, so the symptoms are part of the scoring. Fever is part of the scoring also. Cough. Sometimes the gastrointestinal symptoms like diarrhea, if you have vomiting, nausea. Okay, so not only fever, if he has fever or not have fever. Okay, they have shortness of breath. This is one of the symptoms. So please keep in mind, this is not only the fever. If you have fever, you have COVID. If you don't have fever, the only thing that will confirm is that you have suspected persons. You will do the sample nasopharyngeal swabbing, and after that we can confirm that he has a positive or not. But we have suspected cases. Even some people are asymptomatic and may transmit the disease. Okay. I think I'll take one more question. هل نستطيع أن نعمل مريض مع COVID-19 في غرفة negative pressure? I think I answered this question. Patient came as a emergency for clinic, then doesn't said anything, treated by dealing with the. Okay, if any, this is considered now as suspected. If this question asking if he has he put a scenario, an imaginary scenario that the patient has emergency, he entered to your clinic and passed the triage. He said, I don't have symptoms, I don't have anything. Then after you treating him, he will say, I have fever, I have cough, I have traveled to high risk area. What I can do. Now he considered as a suspected case. As I mentioned before, now the patient have to be transferred. So if his scoring is high, you have to transfer it as a suspected person. And you are protected, okay? You are protected, but not well protected. Not if you do drilling, so you will seek for the medical care also. Until they isolate the patient and see if he is positive or not. After that, you will see how many people he come in contact with. So you are now dealing with a suspected person. But many people, if the patient came with symptoms, it will be clear. If he has fever, has flu, it will be clear. But we are afraid from people that they are asymptomatic. So we are trying to triage and minimize the risk that patient entering the clinic has any chance to be COVID-19 positive. So the patient will be transferred to the hospital after see the results and see if you need to, maybe you will need isolation also, because you are in direct contact, you and the dental assistant. So immediately refer the patient, go also to the ER in the nearest hospital to see if you will be isolated or not until see the results of the patient are negative or not. Thank you all for your, let me share the knowledge with you and for your time. I hope you enjoyed my lecture. Sorry, I have limited time. I want to answer more questions, but
thank you, Dr. Ahmed. Thank you so much. We really thank you for your time and effort in this webinar. We hope that it was informative and helpful for all. We thank you all for attending today. We have to wrap this up so we can start the next webinar. We will start in 2 minutes for everyone who is registered with us. Thank you.
يعطيكم العافية.